Good morning, good afternoon, and good evening. Hey guys, welcome back to the channel. My name is Omer and I'm a doctor. My aim is to bring you knowledge which can improve and sometimes even save lives. In today's video, I'll tell you everything you need to know about stroke. Please bear in mind that from time to time I will be referring you to the video I previously made about angina because the concepts I discussed there also apply to stroke. A stroke is a medical emergency which is time critical. It occurs when the blood supply to a part of the brain is suddenly cut off, causing damage to the brain. Most times, patients are left with some sort of disability following a stroke depending on how big or severe it was and the part or parts of the brain affected. I'll tell you more about how this happens and the typical symptoms you may experience, but firstly, let's talk about the brain, what it does and why it's so important. Essentially, your brain is your computer that controls your body. The brain consists of three major parts: the cerebrum, the brainstem and the cerebellum. The cerebrum looks much like a walnut. It is divided into two halves called the left and right cerebral hemispheres. The left hemisphere controls the right side of your body and the right hemisphere controls the left side of your body. So if you have a stroke on the right side of your brain, then you will experience symptoms on the left side of your body and vice versa. Each cerebral hemisphere is then divided into four parts called lobes. Each pair of lobes have different functions. The frontal lobes are responsible for your cognitive function such as problem solving, judgment, planning, and organizing. They are also in charge of voluntary movements and activity. The parietal lobes are responsible for managing sensations such as temperature, taste, and touch. They are also responsible for handwriting and body position or coordination. The temporal lobes are responsible for your memory, hearing, learning, and emotions. And lastly, the occipital lobes are mainly responsible for vision. All the messages between the brain and the rest of your body have to go through the brainstem. Your brainstem is located at the base of the brain and controls vital body functions such as breathing, swallowing, heart rate, blood pressure, and whether you are awake or sleepy. Lastly, the cerebellum, which in Latin stands for little brain, is located near the brain stem. This part of the brain is responsible for coordinating voluntary movements, maintaining balance, coordination, and posture. We now know the basic functions of the brain, so let's talk about stroke. Statistics from 2016 suggest that there are over 13.7 million new strokes each year globally, and 1 in 4 people will have a stroke in their lifetime. 5.5 million people die from stroke yearly. Around the world, there are over 80 million people currently living who have experienced a stroke. Most cases occur in people aged over 65 years. So how does a stroke occur? Well, each specific part of your brain receives oxygen and nutrient-rich blood delivered to it by blood vessels called arteries. Essentially, there are 4 main arteries that supply the brain. These are the left and right carotid arteries and the left and right vertebro-basilar arteries. These then branch off into smaller arteries which supply different areas within the brain. If for any reason this blood supply is cut off, then that specific part of the brain suffers and the brain cells start to get damaged or begin to die within minutes, and that's why prompt treatment is crucial. If larger arteries are affected, then larger areas or even multiple areas of the brain are affected and the symptoms are more severe. Let's now talk about the very important symptoms and signs of a stroke. A stroke is a medical emergency and needs immediate medical attention. You need to act fast. FAST is an acronym that is easy to remember and will help you recognize if you yourself or someone around you is having a stroke. Up to 9 out of 10 people will experience one or more of the following symptoms or signs. You may experience facial weakness, and this can mean being unable to smile properly because your mouth has drooped on one side. Sometimes water starts drooling from the affected side after a drink. Similarly, your eye can also be drooped on the same side. You might notice these changes in a mirror, or someone might comment on them. You may also experience arm weakness. Weakness usually occurs on one side of the body and can affect the arm, leg, or both. This may range from total paralysis of one side of the body to mild weakness of one hand. You or someone around you may notice a speech disturbance. You might have slurred speech, difficulty finding the correct words, or difficulty understanding others. Equally, others may find it difficult to understand you. If you notice any of the above symptoms, then it's time to call for an ambulance, and you need to be seen by a doctor urgently. These symptoms and signs appear suddenly. Sometimes you may experience them and they resolve within minutes or within 24 hours. This is called a transient ischemic attack, also known as a mini stroke. This is still a medical emergency and you still need to call for an ambulance. You may also experience other symptoms suggestive of a stroke, but these can be quite vague and can occur due to many different reasons. A doctor will be able to differentiate the difference and diagnose a stroke, so if you're worried, then please see your doctor. Other possible symptoms that can be suggestive of a stroke are having problems with balance, coordination, vision, swallowing, or sudden confusion. The effects of a stroke are unique to each individual, and recovering from a stroke is different for each person. Many may never recover completely and be left with long-term disabilities or symptoms that we have just talked about. Earlier, I had mentioned a mini stroke. This is also known as a transient ischemic attack or a TIA. It mimics a stroke, but symptoms completely resolve within 24 hours. In most cases, a TIA is caused by a tiny blood clot that becomes stuck in a small artery in the brain. The affected part of the brain is without oxygen for just a few minutes and soon recovers. This is because the blood clot either breaks up quickly or nearby blood vessels are able to compensate. Please remember, a TIA is still serious and increases your chances of having a full-blown stroke in the future, so you still need to be seen by a doctor immediately and should call for an ambulance. If you have come this far in the video and have enjoyed the content so far and found it knowledgeable, then please consider subscribing to this channel so I can have your support and know that you're benefiting from the videos. Also, like and share the video with your family and friends so that they are aware of the symptoms and signs to look out for to identify a stroke either in themselves or in someone that they may know. You may help save a life by passing them this information. There are many celebrities and famous people that you may know who have suffered a stroke. Some of them are actress Emilia Clarke, notably known for her role as Daenerys Targaryen in the Game of Thrones, late Playboy founder Hugh Hefner, Margaret Thatcher, the former British Prime Minister, singer Jessie J, the late actor Luke Perry, Prince Edward, the Duke of Kent, actor Frankie Muniz, notably known for his work in the sitcom Malcolm in the Middle, and Larry King, the TV host. There are two main types of stroke, ischemic and hemorrhagic. Ischemic stroke is much more common, but both of these disrupt the blood supply to a specific part of the brain, causing damage or death to cells. Ischemic stroke is caused by a blood clot, and there are two ways this can happen, either by a thrombus or an embolus. A thrombus is a blood clot that forms within the artery itself due to atheroma formation, which can cause a blockage. This process is called thrombosis, and it commonly occurs in your carotid arteries. There is a lot to cover in this video, so refer to my angina video where I have already talked about atheromatous disease, how it's formed, its causes and risk factors, as well as ways to reduce these risk factors. This will help you develop a greater understanding of how a stroke occurs and ways to prevent it. In some cases, the blood clot forms in another part of the body and then travels in the bloodstream to the brain where it blocks and disrupts the blood supply. This is called an embolus. A heart condition called atrial fibrillation is the most common cause of embolus formation and can result in a stroke. I will do a separate video and tell you all about atrial fibrillation in the future, so hit the notification button if you would like to be informed when it's released. A hemorrhagic stroke, also known as an intracerebral hemorrhage, brain bleed, or brain hemorrhage, is caused by bleeding into the brain or around the brain. This only accounts for around 1 in 10 strokes. An intracerebral hemorrhage may occur due to trauma to the head or when a damaged or weakened artery bursts and bleeds. The blood leaks out into the brain tissue at high pressure, killing brain cells and causing brain swelling. Generally, people who have a hemorrhagic stroke are more likely to have severe symptoms and greater long-term disability. When you are initially seen in the accident and emergency or casualty department, most of the times a doctor will be able to diagnose a stroke with the symptoms and signs that you present with. However, further investigations will be required to confirm the diagnosis and help determine the extent of the stroke. A brain CT scan will be required to differentiate between an ischemic or hemorrhagic stroke. A brain MRI scan may also be considered in some cases. Blood tests, chest x-ray, ECG are also some of the tests done to see if there are any other contributing factors which may have caused the stroke. Later on, an ultrasound scan of the neck may be done to assess the carotid arteries and the amount of atheroma present. Now let's talk about how a stroke is treated. The initial treatment for ischemic versus hemorrhagic strokes are completely different. There are two immediate treatments considered for ischemic strokes. Firstly, thrombolysis, which means clot dissolving, and secondly, thrombectomy, which means clot removal. If you fit the criteria for thrombolysis, then you will receive intravenous drugs which help dissolve the blood clot. If the brain scan shows a severe ischemic stroke affecting the front part or the frontal lobe of the brain, then you may be offered a thrombectomy, which is a surgical procedure to remove the clot. The sooner these treatments are given, the more successful they are likely to be. For a hemorrhagic stroke, the treatment is completely different and depends greatly on your individual situation. You may require medication to stop any further bleeding in the brain, and an operation very occasionally may be required. You will also require other long-term treatments, and again these depend on the type of stroke you've had. For an ischemic stroke, antiplatelet medication is used. Its function is to make the platelets less sticky to help prevent further blood clots forming inside the arteries. This reduces the chances of further strokes. Examples of these drugs are aspirin and clopidogrel. For any type of stroke, you will also require medication to control some risk factors, such as high blood pressure, which is the single biggest risk factor for stroke, cholesterol, and high blood sugars. The purpose of these medications is to reduce the risk of further strokes in the future. If you have been found to have carotid stenosis, then you have an increased risk of having a stroke. Carotid stenosis means a narrowing in one or both of your carotid arteries, and this is usually due to atheroma. If the narrowing is severe, you may be advised to have surgery to strip out the atheroma. Your doctor will advise you if this is an option. Rehabilitation, such as physiotherapy and speech and language therapy, is very important and should begin soon after the stroke. The patient will be encouraged to mobilize early and work with physio to help with the recovery and reduce the chances of further complications such as clots in the legs or lungs, which can be life-threatening. The rehabilitation process can compromise of many other specialists depending on your needs, and these include occupational therapists, dietitians, psychologists, specialist nurses, and doctors. Within the first 3 weeks of having a stroke, around 3 out of 10 patients will become completely independent, and around 5 out of 10 patients will become completely independent within 6 months. In the UK, you must not drive for at least 1 month after a stroke, and you might need to tell the driving licensing agency. This may be different depending on the country you live in. Guys, we have covered a lot of very useful knowledge in this video, and I hope you or someone you know will be able to benefit from it. I am a full-time doctor, and I have made this channel to provide you with knowledge which can improve and sometimes even save lives. So please consider subscribing for more useful content. In my next video, I will tell you the miraculous story of a patient who came in with a stroke and what happened to her next. So hit the notification icon to receive an alert when I release this video. If you have any suggestions for future videos, then please leave a comment below. All the best guys, look after yourselves, stay healthy, and remember, knowledge saves lives.